Over the past few months, we've reported on the slow response times and missed standards for the ambulance company serving much of the greater Portland area, AMR. Each time, investigative reporter Evan Watson told us that he'd asked the company for an interview, and they said no. And they still won't do an interview, but now they have sent a detailed response. Let's bring in Evan Watson, who's been on top of this all year to break it down.
AMR sent me a breakdown of its issues and current and proposed solutions. The company says it's not alone. There are problems nationwide with emergency health care. Among them, a shortage of paramedics, delays at emergency departments, growing demand for mental health services, and misuse of 911. AMR currently manages EMS in Multnomah County, Clackamas County, and Clark County. Starting August 1st, it will take over ambulance service in Washington County. In Multnomah County, ambulance response times have fallen off significantly, at a rate worse than other counties. The most recent data shows AMR crews were late to respond to 1 out of every 3 emergency calls, taking longer than 8 minutes to get there. AMR blames this on Multnomah County's 2 paramedic requirement and staffing issues. The company says switching to a 1 paramedic and 1 EMT system would provide a strong solution. The county's pushed back on this. AMR says it acknowledges challenges with response times elsewhere, too. It says it's made good advancements to return to compliance in Clark County, but still, at least 850 times this year, dispatchers didn't have an available ambulance crew to send to an emergency call. The company says Clackamas County has been the least affected because of good workforce retention. All of that brings us to staffing. AMR says it's responsible for staffing problems in our region, and it's doing everything it can to hire more workers. The company is short-staffed in each county. It needs 9 paramedics and 13 EMTs in Clark County, 5 paramedics and 4 EMTs in Clackamas, and 38 paramedics in Multnomah County. AMR says it expects to be fully staffed in Washington County by the August 1st start date, but it still needs to hire 9 more paramedics there as well. So what does AMR say it's doing about all of this? To retain workers in Multnomah and Clark County, AMR says it's giving pay increases of 30% to current staff through 2025, plus paramedic scholarships. And AMR is trying out different strategies to triage 911 calls, hoping to improve response times and free up paramedic crews for serious emergencies. For example, AMR has added basic life support or BLS programs for low acuity calls in Clark and Multnomah County, sending 2 EMTs to take care of low-risk situations. AMR says it has the experience and knowledge to overcome current challenges, but it's also worth noting its national parent company, Global Medical Response, currently has $4.3 billion in debt that will become due in 2025.
Evan's here now. Is there anything about this statement that surprised you?
It was interesting receiving it. I've received very short 1-sentence statements from AMR in the past few months covering this. This was the biggest and first real acknowledgement of, hey, we have issues and we're recognizing those publicly. I think the other thing fascinating with this is the look at the different counties and comparing what the service looks like there. They mentioned Clackamas County very briefly because they say they're doing pretty all right with retention, but Multnomah County, they said it's disproportionately bad compared to the other counties. So in all, there are staffing issues and need for paramedics and EMTs, and the new service starts August 1st in Washington County, like we mentioned, and they have these plans to kind of triage it out and figure that out as the second part. So you hire more people, and then you also triage the service so you can get better response and not bog down the paramedics. But this was surprising to me, just seeing them acknowledge it and send such a detailed statement saying, hey, here's where we're at, here's where we're looking to be. Now it's on us to make sure that they get where they need to be. Yeah,
and even though they've been somewhat tight-lipped with us, it's obvious that on the inside, they're looking at the same issues we're seeing from the outside. So it is nice to finally hear them saying that. Thanks.
Evidence of that pressure mounting to a point where, hey, we need to come out and make a statement.
Yeah, I'm glad they did. Thanks, Evan, for following up on that. Appreciate it.